बहुत बहुत आभार। मैं अब अपनी तीसरी वेबिनार जो बड़े इम्पोर्टेंट रोग हीमोफीलिया पर बेस्ड है। हीमोफीलिया जिसको होता है वही जानता है। These hemophilia cases are really mentally harassed because of this hemophilia. So without wasting much time, we are already late by two webinars. In AYUSH SAMRIDDHI 1424th webinar, we would like to welcome you all. Our speakers of the day are Dr. Suparna Sanyal Mukherjee, Madam. Welcome you, Madam, again. Welcome, welcome. And Professor Shubhamay Das, first time on our platform. Welcome, Professor Shubhamay. We are sorry that we are late, but the discussion was so important that we couldn't stop the speaker. Thank you very much for joining. And now I would like to invite Madam Suparna Sanyal Mukherjee, Madam. Suparna ji, welcome. Dr. Suparna Sanyal Mukherjee, Madam. Welcome, welcome.
Good evening. Yes, a very
Yes.
good evening to all the dignitaries over here. So basically, the hemophilia, which I have chosen for this, say something regarding this hemophilia. Hemophilia is a disease which is the caused for this, the genetic disorder. At the same time, the blood clotting disease. So this may form any type, any kind, and any situation. The mutation may happen. In that case, what used to happen? The blood clotting is going on. So when this blood is clotting, that means the transfusion of blood is very restricted, and it is not good for the patient because blood is coming in the urine, in the stool, in any kind. So it should not be stopped. So this is the causes of genetic disorder, or the mutation is the main cause for this clotting. So this is the what is hemophilia, and the correlation with the tribes is very emphasis point and burning topic nowadays, because those tribes, those who are living in the deep inside the forest and the forest range and the hill areas and the dense forest, so they don't have any idea. At the same time, they have the consanguineous marriage. Consanguineous marriage, that means their marriage is going on within the kinship. So in this kinship pattern, so they are following the blood related marriage. And when the blood relation in the same family or kinship pattern, so they are practicing monogamy. In that case, the gene used to be dominant at the some areas and some cases and some generation. So the patient is suffering the hemophilia baby may born. So in this hemophilia baby, when this type of baby used to born, so the parents are very dangerous in situation, just because of the they don't know what may happen, why what has happened, because every situation when the same gene is coming from generation to generation, so it is the this disorder may happen and the gene may dominate, this hemophilia gene may dominate in the generation, in some generations. So it is it is also found in the Muslim society like the Pakistan, then the Afghanistan, then the other societies, the Muslim societies, those who are practicing the kinship marriage, the blood related marriage. Because when the blood related marriage, there is a no scope for the heterogeneous aspect. So it cannot be changed. But one generation to generation, if the same gene is transforming from first generation, second generation, third generation, fourth generation, if it is going on, so the mutation may happen, the sudden change may happen, and that time it is used to be the hemophilia baby may born. So this causes a very fact in that case of the tribal life. In the tribal life, they have no idea because their marriage is going on in the same blood group. So when they are practicing monogamy, where is no polygamy or heterogeneous genes may come. So these people are suffering from this hemophilia. At the same time, their socio-cultural, socio-economic pattern and techno-economic pattern is also encouraged this hemophilia baby. Because socio-culturally, they are so primitive, they practice the forest deity. And at that cases, when they are practicing the deity, this deity is very dangerous. Because in some cases, like Abji Maria, those who are living in the absolutely Madhya Pradesh, the Chambal region, those people are practicing used to go the free sex. In that case, they used to go to the after puberty. They used to go to the ghotul, and when they used to enter into the ghotul, there is the free sex. They can use anyone for the any person. So when they become the pregnant, that time the Gram Sabha used to take the decision who become the father of that particular child. So in that case, what has happened? When they are practicing the multi-sex, and in that cases the sudden change may happen of the gene. So this is the conditions. So the travel, especially the travel area, the consanguinity is the main factor. Consanguineous marriage is the causes for the hemophilia patient may born. Because consanguineous marriage, there is no restrictions of the gene, because one gene, when the gene cannot get the opportunity to develop and the heterozygotic condition, because they are the forming this monogamous and this monozygotic condition, and at the same time the same gene is practicing generation to generation. That's why they are forming this consanguineous marriage. And consanguineous marriage is one of the main cause in the tribal society. That's why they are suffering from this hemophilia disease. And the same at the same way, in Muslim community, it is also the consanguineous marriage is very prominent and burning cases for this hemophilia baby has born. So there is no cure. Ayush may develop it may control the probability and possibilities by the mass education, by the awareness program, by the medical awareness program, and this what is the causes for hemophilia. If the people may know, so they can they can leave the consanguineous marriage and they can enter into the heterozygotic condition, heterogeneous life if they can lead. So it may not be eradicate, the ratio may be fallen. So this is the main point for this hemophilia. Thank you very much. Thanks to giving me such an opportunity to say something about it.
Thank you, madam. Thank you very much. Very nicely explained in brief. Excellent. Now I would like to request Professor Bhomik. Welcome, Professor Bhomik.
Yes.
Welcome.
Yeah. Am I audible?
Yes, clear.
So I'm Sharif. That's my wife mobile. Just I am Professor Das, Professor Shubhmay Das. So from Kolkata, Mahishadol Raj College. So good evening, everyone. Just Professor Suparna nicely explained what is a hemophilia. I am not from the Ayurvedic background. I am typically from zoology background. I am working in the field of genetics for the long time in this field. So I would like to explain a little about what is hemophilia. Actually, in our blood, we have basically three types of proteins. One is the blood clotting factor, the fibrin. Second group, the albumin. And third is globulin. Globulin makes antibody. Albumin is responsible for the osmolarity of the blood. And the fibrin or fibrinogen responsible for blood clotting. The name of the disease is called hemophilia. The word hemo means blood, philia means loving. Actually, the correct word is not the hemophilia, but hemorrhagophilia, bleeder disease. That's called the bleeder disease. When a wound is there, after 2 or 3 minutes, there are several factors that they are responsible for the clottings of the blood. But this is a genetic disease, but this is not due to mutations. Again, I repeat, this is not due to mutations. All mutations are there. Our just it is the permutations and combinations of that chromosome. So hemophilia is a bleeder disease. It is not due to mutations. So can I share? Okay. Hello, is it visible? Hello, is it visible?
Yes, yes, clear
Yes.
visible, clear.
Yeah. So hemophilia cause and management, very simple. It's a hereditary blast disorder, and it is due to two factors. For the blood coagulations and blood clottings, we need 14 factors. Out of 14 factors, two factors are very much important, the factor 8 and factor 9. Hemophilia basically are of three types: hemophilia A, hemophilia B, and recently discovered hemophilia C. Hemophilia A is the lack of factor 8 or Christmas factor. Hemophilia B is lack of factor 9, and hemophilia C is due to lack of factor 11. So probability of hemophilia A is more in our society. They're about 10% per 1 lakh people. Hemophilia B, its probability is little bit less with a 3% per 1 lakh people, and hemophilia C, least probability with 1 people per 1 lakh people. So this is the hemophilia disease due to lack of clotting factor 8 causes the hemophilia A, clotting factor 9 causes the hemophilia B, and clotting factor 11 responsible for the hemophilia C. Whatever in these types of diseases are completely genetic diseases. Hemophilia gene, hemophilia gene is not dominant but recessive. Normal gene, normal clotting factor gene is a dominant, but hemophilia gene is recessive. But when the two recessive gene appears at the same time, it appears. So the probability of hemophilia female is less, but the probability of hemophilia male is more because this gene presents the X chromosome. As the male has only one X chromosome, the probability of hemophilia male is very, very high. And whereas the X chromosome of female, the two doses, so the probability of hemophilia affected female is very, very less. So this is the transmitted by a female to male, and male are basically suffered. Whatever the history we know from 2nd century AD, the first report of hemophilia, and the term coined in 1820 and called the royal disease in the royal family the first time. So this hemophilia, I already discussed the recessive gene and only the present only the X chromosome. Through the X chromosome, if two X chromosomes are affected in case of female, they call the trait or the patient. But if the female only one X chromosome having that hemophilia gene, they are called carrier, and these are very dangerous. The silent killer, the silent carrier of the female, when they remain the heterozygotic conditions, they act as the carrier in our society. The male, if they have that particular gene, they certainly express the hemophilia character. So, female, which so this is the royal pedigree, the first pedigree constructed by the scientist, and the cause of the hemophilia that I try to explain this. The male has a X and Y, and the female has a 2X this. If a female have the 2X only that express, but the male only 1X and 1Y, that hemophilia expressed. So they're the cause of hemophilia. So to in case of male right hand figure, male is affected because only 1X is there. So the high chance of affected male. If male is affected but female is not affected, no chance in the next generations. And if the female is carrier, the male is the 50% male and the chances. So only and only way to resist or to prevent these types of hemophilia disease only is the consciousness and the blood testing. If any reports are there of hemophilia, especially before marriage, so many genetic counselings are required to prevent or to check this disease in our society. Until unless these types of awareness are there, not a single medicines are there still now, because these are completely genetic. No one have to do anything. If any disease, any types of disease appears in any generations, in any family, then nothing have to do. So only the consciousness. Now, this is the simple way of the blood clotting, this mechanism. Here you observe the factor 8 and factor 9 are responsible for blood clotting. If the factor 8 absent, hemophilia A, factor 9 absent, hemophilia B, and but these are the X-linked inheritance. But hemophilia C responsible for autosomal. So the in hemophilia C, the probability of male and female affected childs are 50-50. But hemophilia A and B, male childs are mostly affected than the female. Now, I already discussed hemophilia ABC, factors, X-linked and autosomal link, and the hemophilia A, mild hemophilia A, moderate hemophilia A, and severe hemophilia A. Now, what happened? After makes a wound, within 2 to 3 minutes, generally blood clotting occurs. But when hemophilia occurs, after bleeding starts, after 5 minutes, 10 minutes, 15 minutes, half an hour, the blood never stops. That's called hemophilia is a bleeder disease. So delayed blood coagulations, delayed blood clottings. So if injury occurs, in case of normal, within 2 to 3 minutes, stops the blood bleeding, but hemophilia A still continues to bleed. Now, hemophilia A, Christmas 9, Christmas factor, and what the symptom? How a person, other Suparna ma'am told that so many tribal peoples are very much affected in this hemophilia. So how one can understand, oh, I am affected of the hemophilia, or am I carrier of the hemophilia? So many symptoms are there by which we can easily understood, yes, one person is hemophilia without testing. So many symptoms are there, especially the joint pain, joint injury, and joint bleeding, muscular bleeding. So oozing after injury, repeated bleeding after first bleeding. So very simple is that profuse bleeding. So hemophilia, especially at the joint regions, the special red marks are there. So internal bleedings are going on. So next, how hemophilia diagnosed? So many processes are there. So many genetic counseling centers are there by which, by testing the factor 8 and 9 in our blood by electrophoresis, or different types of methods are there by which we can easily determine that am I hemophilia carrier or am I hemophilia A or B patient. So we can easily test before, especially marriage. Before marriage, everyone should test the hemophilia and these types of genetic disorders. So what will the treatment? Actually, there is no treatment at all. If one affect to the lifelong, they never survive, especially female never survive after 20 or 20, just after starting the menarche or the first menstrual cycle. When a female is affected in the menstrual cycle, profuse bleeding, the they never survive. But in case of male, they survive if there are not no such major surgery or major accidents are there, they may survive. But what is the management strategy? Very simple. Only the management strategy are there. Replacement therapy, gene therapy, and one drug is there. Desmopressin is there, and other therapeutic unit are there. Now, prevent what we will do if hemophilia patients are there. Very simple. Prevent joint degenerations. Immobile joint during acute bleeding. During acute bleeding, never move the joint regions. Progressive exercise, yoga. Yoga is very much important. Prolonged yoga is very much important for progressive exercise, and you have to avoid prolonged immobility. So avoid contact sports, these types of hockey, football, and cricket, these types of contact sports, especially when the joint activity is very much high. So we should avoid this. And during injection, we never take intramuscular injections. If we take intramuscular injections, if a bleeding starts, it never stops. And special types of, because especially aspirin, these types of drug, a patient never take these types of aspirin like drugs. So replacement therapy is nothing but take the blood, replacement therapy, fresh whole blood transfusion technique, whole plasma transfusion technique, and fresh frozen plasma technique. So this is the only and only, especially factor 8 and factor 9, these types of protein, if administered in a patient body, a simple reliefs may be there, little bit relief. Now, this is the normal bleeding and the hemophilia bleeding. This is the gene therapy. Yes, and the most important is there, recently gene therapy is done, but it is not completely tested. Still, the scientists are trying gene therapy. In the gene therapy type A, hemophilia factor 8, and gene type B, factor 9, these types of gene present in the X chromosome that should be delivered in the patient body, and it are not completely succeeded, but partially success. So another drug is there, desmopressin. So desmopressin is one types of chemicals of the drug, one types of hormone also, the factor 8, and this increase the synthesis of factor 8 by indirect way. So administration or injection or nasal spray, these types of drug, so for a little bit better result. And another treatments are there, so many treatments are there. But in Ayurveda, actually ashwagandha, especially you know that ashwagandha is a and guduchi, these types of herbal supplements, Ayurvedic doctors may recommend herbal supplements such as ashwagandha to help them manage the symptoms of the hemophilia, but they never cure. The hemophilia. So basically the lifestyle modifications, and the Ayurvedic doctor may recommend the lifestyle modifications such as yoga and meditations to help the manage the stress and improve the overall health. Otherwise, nothing is there. So, this is the 14, 15 factors responsible for blood clottings. Hemophilia A, this is the hemophilia B, and what are the clinical symptoms. So only and only the consciousness, only the genetic counseling before marriage, the only way, and the marriage between closely related persons is only and only way to prevent these types of hemophilia, especially hemophilia A, B, and C. So if we want to create a hemophilia free world, so in that case, we have to eliminate these types of gene by consciousness or proper marriage system. So, and in near future, few medicine I think will be there, which can give some comfort, but not cure this disease, as this is the genetic disease. So we hope for the best. So educations, only educations, consciousness, and premarital genetic counseling is only way to remove these types of disease, genetic disease from our society. Thank you, all of you.
Thank you, sir. Thank you very much. First time on platform and century. Excellent. Very nicely explained. Very nicely explained, sir. Professor V.K. Agnihotri ji is with us. Excellent speech. Really, Gajanan Hegde ji, would you like to say something? Nishant ji, Professor Nishant Shukla ji. Excellent. Bhomik Sahib, excellent. You have explained very nicely and in brief and in deep. That is the beauty of your presentation and your speech. Please do join with us. Please do join with us.
Thank you.
Because we are conducting webinar on each and every topic of the life. Yesterday was the we have celebrated Jumbo Day. Jumbo was the elephant before 150 years, and then Pet Day. So pet care and Jumbo elephant care by natural traditional way. So vet experts were was with us. Thank you very much.
Actually,
please tell
me. Actually, I am very much interested in the elephant. Okay, during the elephant behavior and the Indian Institute of Science, I worked on specially elephant behavior. Elephant is there in biasness with the male?
Please be in contact. I will give you a number. Dr. Andy Sharma.
Yeah.
Dr. Andy Sharma is a member of Go Seva Ayog in UP Lucknow, and he is really expert. He will explain you whatever you want.
Yeah.
Dr. Andy Sharma from UP. Very senior. He is going to be 90 in this June. 90 years.
Yeah.
He was in Forest Service.
Yeah. Just I worked under Raman Sukumar of Indian Institute of Science, the elephant specialist, Indian Institute of Science, Raman Sukumar. Right. So, okay, thank you, Sean. Thank you very much. Good night.
Thank you very much, sir. Thank you very much. If anybody would like to add anything, शोभन जी हमारे साथ हैं, गजानन जी हमारे साथ हैं, आदरणीय गजानन जी, शोभन जी, स्वागत है गजानन साहब. प्लीज अनम्यूट.
अति सुंदर. अभी जो वेबिनार मैंने ज्वाइन किया, कल आपने बताए थे समृद्धि, इसका आयुष समृद्धि का वेबिनार चलता है, तो मैंने आज इसीलिए मैंने थोड़ा समय निकाल कर इसके लिए मैंने रिजर्व रखा. अभी मैंने योगा थेरेपिस्ट विषय का, आयुष मिनिस्ट्री का योगा थेरेपिस्ट का भी मैंने अभ्यास किया हूँ. अभी मधुमेह वाले के लिए मैंने मधुमेह प्रबंधन स्थूलता निवारण, इस विषय का ऊपर में भी मैंने सेशन कंडक्ट किया हूँ. 6 days continuously I have conducted the session and so many उसका लाभ लिया है, बहुत लोग लाभ लिया है. अभी इस प्रकार का वेबिनार में मैं हमेशा रहता हूँ. आनंद हुआ, आपसे कल मिलके आनंद हुआ, और आज मैंने इस वेबिनार सेशन में किया है.
आज हमने 3 वेबिनार कंडक्ट किए सर. पहली वाली मधुपैथी हनी पे, दूसरी लिवर डिसऑर्डर पर, और तीसरी हीमोफीलिया.
मैं था लगभग 8:30 बजे से मैं था.
जय हो. हमारा सौभाग्य सर.
नहीं, मुझे आनंद मिला.
जय हो. बहुत अच्छा लगा. लोगों को जोड़िए सर, ये निस्वार्थ सेवा है. पहले एक्सपर्ट्स पे ये आरोप लगता था कि एक्सपर्ट्स अपना ज्ञान नहीं देते. मैंने ये गलत पाया सर. हम लोग ज्ञान देने के लिए हैं, सुपात्र नहीं है. सुपात्रों की कमी है. इक्वल है. थैंक यू
थैंक यू सो मच.
थैंक यू जी. तो
सभी को गुड नाइट. बहुत अच्छा एक्सप्लेन किया शुक्ला जी. डॉक्टर निशांत शुक्ला जी, उन्होंने बहुत अच्छा से एक्सप्लेन किया है. मैं डॉक्टर मांडलिक गुरु जी के साथ जुड़ा हूँ, योग विद्या गुरुकुल नासिक, वहां से मैं जुड़ा हूँ.
बहुत अच्छा.
और स्वामी रामदेव जी वगैरह, उनके वहां से भी सहवास है लास्ट 20 years, more than 20 years.
गजब।
एंड अष्टांग योग का उपासक हूँ, साधक हूँ। एंड
जी
अभी योग तज्ञ का भूमिका में हूँ। और
नहीं, आप
चलिए,
लोग कर्मयोगी हैं साहब, पूरे